Welcome to another exercise video from 919clinic.co.uk. I am John Ostrovskis. Today I'm demonstrating a series of 3 exercises for the spondylolisthesis patient. Now, what spondylolisthesis is a slight deformity in the structure of the lower spine through here, which renders the low back, this area here, unstable. The way this manifests usually is lots of tension in this area here and an immobility in pelvic movement. So the first exercise I'm going to demonstrate is a gentle pelvic mobilizing routine. This will be followed by what's called a transversus abdominal exercise, which refers to the abdominals below the navel, the lower aspect of it, followed by a gentle stretch. So with the first exercise, with the pelvic tilt routine, if you make a diamond with your hands so that your index fingers are touching and your thumbs are touching. Now, you lie down on your back, just with the knees bent up comfortably, the feet flat on the floor, and just assume that's a diamond shape with your hands there, and just place them on your abdomen so that your little fingers are right on that crease at the top of the legs there. You need to imagine that you've got a marble in this diamond, and what you want to do is tilt the pelvis so this imaginary marble comes to the top end of this diamond. Hold for a second and imagine that you're rotating the pelvis to take that marble down. You can see as you're doing this, the pelvis tilts. And the usual dosage of this exercise, so the marble's going to the top of the diamond, and then the marble's going down. And the usual dosage is about 15 repetitions through this cycle of rolling up and down. Just perform slowly and in control. Once you've performed that exercise, then we get onto the transversus abdominis exercise, which is an exercise to strengthen these abdominals, the area below the navel. So if you keep that diamond there, if you adjust your posture so that the marble is in the midpoint, the center of the diamond, and from there contract the muscles as though you're stopping the flow of urine. Hold that and then squeeze the navel down to the spine hard as you can. Now, as I'm holding that, I can just feel a really good contraction just down here, just below the navel. You hold for about 5 seconds and relax. Keep those muscles that control flow of urine contracted, and squeeze the navel down to the spine with about 30% effort. So a bit more relaxed with the second contraction there. And then repeat that cycle of keeping the muscles contracted that would stop the flow of urine. Squeeze that navel to spine hard as you can. Relax those muscles. And then contract those same muscles to about 30% and hold for about 5 seconds. That's a really good way of starting to wake up the musculature around here to add stability. The last exercise in this series is a gentle stretch. Now, most patients who suffer from spondylolisthesis will find this to be a good way of relieving pain. And first of all, from this position, bring one knee to the chest and then gently bring the other knee. And just squeeze the knees to the chest, just as far as you're able to, just using moderate effort, not straining. Hold for 15 to 25 seconds. And then lower. Usually this exercise will be repeated 2 to 3 times per session, and usually we would recommend 2 sessions a day. Thank you.